Welcome back to Daily Connections. If you find that you're someone who regularly eats until you're stuffed and you can't control it, then you'll want to pay close attention to our next guest. Maureen Kritzer-Lange is a psychotherapist and the president of the Eating Disorder Association of New Jersey, and she's here to share important information on a somewhat new disorder called binge eating. Welcome, Maureen.
Hi.
It's good to have you here. Now, what is binge eating exactly?
Binge eating is when you eat large amounts of food in a short period of time, and it really feels like you're out of control eating. It's feeling uncomfortably full. It's when there's a feeling of being secretive about food, being ashamed about how much you've eaten, and like I said, it just feels like it's out of control.
Now, I called this a relatively new disorder, but this isn't a new problem, is it?
It's really not a new problem. A lot of times you'll hear people talk about being a compulsive overeater, and it's very similar. I mean, people have overeaten for many, many years, right? Centuries, for a long time.
Yeah.
So, but it's being recognized because there's some specific things about it that make it unique to just plain overeating.
Yeah, and there's some things, this is unique and different from binge and purging, correct?
Right. It's very different in the way that it involves binging and purging, or bulimia nervosa, is when you binge, but then you get rid of the food by either vomiting. People take laxatives, people take diuretics, sometimes people even over-exercise to compensate for how much they're eating.
To get those calories out of their system.
Although the exercising piece isn't really considered bulimia nervosa, it's really binging and finding a way to purge the food.
But regardless, what makes it unique here is we're really talking about binge eating and retaining all of those calories, or retaining all of whatever was in what you've eaten.
Right. Is that you don't have a way to get rid of the food, but you just end up overeating and, like I said before, just being really uncomfortable.
So let's revisit the signs that someone has a binge eating disorder versus just simply overeating once in a while. What are those? What are those signs? What are we looking for?
Well, it's part of the difference is you or I may go out and end up overeating at a dinner and feeling full. Go
out to a restaurant, have a mashed potato or a steak, everything, we walk out going, oh my God, I can't believe we ate so much.
And you're stuffed, right?
Okay.
But this is somebody that frequently overeats. And again, there's an element of secrecy to it. And there's a lot of obsessive thoughts about food. And so food becomes this this way of thinking and an obsession almost.
Really? And you say obsessive thoughts. Can you give me an example of what you might mean?
Well, somebody will get up and start thinking about what they want to eat for breakfast. Or they'll think, a lot of times, I'm not going to eat today, I'm going to be good, and then end up binging later on. One of the things that I think is important is when food really interferes with your daily functioning. I mean, that's a main key.
So you're eating so much, thinking about food so much, thinking about restricting yourself from it, and then diving into it so much that it's getting in the way of your everyday life. Right.
It really can interfere a lot with your relationships with people. People find it can interfere with work. It just really becomes very disruptive to daily life.
I would imagine. Now, you mentioned the secrecy and the fact that you avoid people. Are there other ways that it can be disruptive? Like you said, the secrecy in particular interested me. What do you mean by that? Not telling people that you've eaten?
Well, I think people will eat alone. Is that it's somebody, just as an example, who after dinner, you're finished with dinner, cleaning up the kitchen, and will end up going back later and sneaking into the refrigerator or the cake that was left on the table or whatever it was, and end up eating uncontrollably again.
So if you find yourself sneaking food, not telling anyone, eating it alone, hiding it in places, eating large amounts of it, doing it because you can't stop thinking about it, that's when you know you kind of have that problem, right?
The other The
Yeah,
other
go ahead.
I'm sorry. The other piece of it too is people describe feeling kind of numb, sort of a little bit in a I say dissociated state. I don't know if you know what I mean by that, but just sort of feeling a little bit out of it.
Disconnected?
Disconnected, right. That's
Okay.
a good word to think of when they're eating so much, because they're really not conscious of how much they're eating. It's when you take the first bite and you taste it, and then after that, you don't even realize how much you've eaten.
So if it's not about hunger, then why are we always eating? Why are they always eating, I should say, you know?
That's a good question. I think that most of the times people eat because of emotional reasons. So a lot of times it is because of stress. They had a bad day at work. They just end up eating. Really, again, very unconsciously, it becomes a learned behavior, and that they just learn to go to the food as a way of dealing with their emotions. A lot of times, some research has shown that people who tend to be depressed, it's a way of coping with depression, will overeat.
Kind of, you know, psychotherapists have been on before to talk about that idea of filling up that void.
Right. Exactly, exactly. Because if you think of binge eating, it really is filling yourself up. But I know a question that I ask a lot of my patients I see is, what do you need? What is it you're not getting that you have to fill yourself up with food? And emotionally, what is missing for you?
Interesting. And then I would imagine with all of this eating, and do people lose their hunger signals?
Well, what happens is they do lose their hunger signals, because a lot of times people who are binge eaters tend to start out dieting. And then what happens is you restrict what you eat and you feel deprived. And what happens when you feel deprived? Then you want it even more. Right, right. So you deprive yourself of that food.
Don't cut anything out of your life.
Exactly.
Everything in moderation.
Everything in moderation. That's absolutely true. So you want it even more. And so then you end up just overeating, and you don't even realize that you're full. And sometimes when that happens is then you aren't hungry at a regular meal time, say.
Right.
So you don't eat that meal, and then you're hungry again later.
And
so
then your nutrition, too,
cycle.
would be off, because, you know, you're binging on foods that you're craving and that you want, and they're not always your vegetables, your broccolis, your carrots, and your spinaches.
They're very rarely those foods.
So
absolutely.
talk to me a little bit about the complications, then, that binge eating disorder can create.
Well,
Health complications.
there are a lot of health complications. A lot of the people who have binge eating disorder tend to be overweight or obese. And part of that is because they can't really control the food. So a lot of the medical complications are things that go along with obesity. You know, high blood pressure, diabetes, thyroid problems, you know, all the things that go along with being overweight.
So that makes a serious problem even more serious.
Right, right. And it can be really hard to control.
Yeah. Oh, I can imagine. I can imagine,
Absolutely.
like anything else. So can you talk to me a little bit about treatment?
Yes. Treatment involves, first of all, it is really a difficult disorder to contend with. And treatment begins with seeing a therapist. And a therapist will work on the feelings around the food. Again, in my practice, I see a lot of people with binge eating, and we work a lot on the feelings around the time of the binging.
Feeling driven.
Right, and I think an important element in that is, and I use this word a lot, is to be mindful. It's how do you get to be mindful about what you're eating, as opposed to just numbing out, disconnecting, and just eating without thinking about it. So really learning to be aware. But in addition to therapy, sometimes medication can help through a psychiatrist. I always suggest that people go to their medical doctor, their internist, or whatever medical doctor they see, to really, again, check out from a health standpoint.
Important.
That's so
especially
important.
when you're talking about all all of the effects that this can have.
Right, absolutely. But the other piece too is working with a nutritionist, because again, your whole eating cycle is out of whack. And some people feel like they're really knowledgeable about, well, I know what foods to eat and I know the right things. But again, it's really getting yourself on a schedule of eating 3 meals a day, putting in snacks, and trying to regulate your eating again, so you don't get into that whole deprivation, filling yourself up, that cycle again. Those components are really important.
Thank you for being here, Maureen, because I'm sure there's people out there who've realized how difficult it is. Maybe they've struggled with it themselves. They've struggled alone. There are people out there who can help them. They're not alone, and
they're not.
Oh, it's so nice having you. Thank you so much, Maureen.
Thank you so much. Thank you.